Do you have blocked nose or you have a crooked nose? Don't worry, I have a solution for you. Hi, I'm Dr. Prajwal.K, consultant maxillofacial surgeon from Praaya Aesthetic International, Shumoga. In this video, I will be answering all the frequently asked questions, especially the rhinoplasty or nose job surgery. So why are we waiting? Let's get started. Rhinoplasty means nose surgery or nose job. Some patients come to us with cosmetic reasons, saying that they have a deviated nose, they have a depressed nose. Some patients come to us with a broad nose complaints. So depending on the patient complaints, we can correct the nose shape, that's rhinoplasty. The second thing is breathing issues category. So these patients come and say that they have a blocked nose, they have difficulty in breathing, they have snoring issues. So this is the second variety, that's a functional problem. So both cosmetic as well as a functional can be addressed in one go, that is rhinoplasty. There are various benefits of rhinoplasty. First and foremost, the cosmetic improvement of your face, because nose is the chief seat of your beauty. So when we improve the nose beauty, the overall facial appearance improves. So the first and foremost is the facial balance or the facial aesthetic improves with your rhinoplasty surgery. Second thing is the breathing problem. The breathing issues definitely betters when we do a septoplasty along with rhinoplasty surgery. When we do an open nose job, we also address your nasal septum, that is bridging in between your nose. So when we address that, overall your breathing improves. When your breathing improves, your life also improves. So these are the two main benefits of rhinoplasty. Most of the patients who come to us are in the middle age or little aged patients. So all of these patients definitely will have some of the systemic issues, most commonly diabetes and hypertension. So they are not a contraindication for your nose surgery. I'll tell you why. We have a team of anesthetists, physicians who will run several tests for you before you are going on the table in the operation theater. So once you're fit, if your diabetes is under control, if your hypertension is under control, I will tell you, you are the right candidate for the surgery. So when you come to us for the nose surgery at Praaya Aesthetic International, our anesthetists run some tests to check your heart rate, your ECG, so your blood pressure, everything will be checked. So once we know you're fit, you will be posted for surgery. So don't worry, you are safe at Praaya Aesthetic International. So this is the most common questions my patient ask when they come for surgery. Are the results permanent? Yes, definitely. At Praaya Aesthetic International, we always use your rib cartilage, which is your own body graft. That's why it is a permanent result for you. So when we take other materials like a foreign material, so definitely they will cause some problem in the future. But whenever we take our own cartilage, for example from the rib or from your ear or your own nose septum, it is always permanent result. So we at Praaya Aesthetic International, we always prefer a rib cartilage for the same reason, because once surgery is done, it should be lifelong. So even when you cross 30-40 years after surgery, there will not be any complications or the results will remain the same over the years. So we suggest you to come to Praaya Aesthetic International, get your consultation from our surgeons, and then get ready for your surgery. So it is very common for the patients to be worried before surgery. So there are many questions pop up in their mind. So one of the most common question they ask me is, Doctor, what are the complications of surgery? Yes, this is a very good question, I would say, but I will tell you there's nothing that you should be worried. There are very few complications that I would think of, because whenever we think of surgery, it is common that initially 1 or 2 days you will have some amount of swelling, some amount of bleeding. So these are all very common and it is easy for us to address. So you don't have to be worried about these kind of complications. So following the surgery, you will be kept in the hospital for 2 to 3 days whenever we do a big or a major nose job like open structure rhinoplasty. So this is a very common I would not say it as a complication. So this is a sequel of the surgery. So there are no major complications because we are not using any kind of a foreign material or implant for you, because those implants are always outside material, which will definitely give you some amount of problem in the future. So when you come to rhinoplasty surgery at Praaya Aesthetic International, we would advise you to get admitted at least for 2 to 3 days. So this is done because we give general anesthesia to do the surgery, and also it's a major surgery. We will be harvesting your rib cartilage and doing a nose job. So you will be having some amount of discomfort rather than saying it is a pain. So it is advisable to take injections to give you antibiotics rather than taking medicines. So it is advised at Praaya Aesthetic International at least 2 to 3 days of minimum admission for the surgery. When you come to us, you will be seen by me or another surgeon. So we will examine you and then we will do a scanning for you that will give us impression of your bony anatomy in the nose, or you have any breathing problem, or is there any kind of a soft tissue problem inside your nose which is causing, or if you come to us for a cosmetic improvement, we will be able to see the amount of cartilage that you have that we need from outside. So everything will be seen in the CT scan. So once the scan is done, you will be seen by our anesthesia team. So they will check your fitness, they will run some tests. So they'll check whether your heart rate, your blood pressure, your sugar levels, everything is normal. So they make sure you're fit for surgery. Once that is done, you will be taken to the operation theater. You'll be given all the kind of care that is required. So once the surgery is done, you'll be admitted in the hospital for a minimum of 2 to 3 days if it's an open structure rhinoplasty. If you are undergoing a closed rhinoplasty, it's just 1 day. That's going to be a day case surgery. You come in the morning and then you go home at the night. So this is overall a journey that you will be seeing in Praaya Aesthetic International. So once these things are done, you will be in constant touch with our hospital team during the recovery. You don't have to come to the hospital unless you have any specific questions. It starts from your tip graft. So whenever patient is having unsupported tip, when there is a loss of tip support, we use a tip graft. So we also use something called a septal extension graft for the septum whenever do a lot of work in the septum, and also it gives a very good tip support. And the various other grafts that we use are a diced cartilage graft that we use it to give you the augmentation at the radix level, the dorsum level. So we mix the diced cartilage along with the Surgicel or any other hemostatic agent, and then we place it to give you a beautiful dorsal aesthetic lines. So we also use a rim graft whenever required. So many of my patients think once the surgery is done, everything is done. No, it is not like that. A good post-op care by yourself is very, very important. So first and foremost, at least a minimum of 7 days to 10 days of good rest at home is very important. So when you have this amount of time, please undergo the surgery. The second thing is very common, avoid heavy lifting or any contact sports, avoid going to gym at least 1 month time post surgery. The third instruction that I would give you is avoid going to dusty places, avoid going to some crowdy places, just to, this avoids a catch of some infection, which will definitely cause some problem for your graft that we place during rhinoplasty. Be at home, eat good food, hydrate well. So rhinoplasty is a 100% safe surgery when it is done by right surgeons and a right hospital like Praaya Aesthetic International. So these results are permanent, these are for life. So this can be cosmetic correction, or it can be a functional issues, or both. So all of these can be addressed in one surgery, and also we can do a concomitant procedures along with rhinoplasty. Most of this patients come to us for a chin surgery which will balance the face. So this can be associated with other procedures like this in one general anesthesia. So when you come to the hospital, we will be keeping you for 2 to 3 days, and you will be taken up care by our hospital staff, a nursing staff. I hope I've answered most of the questions. Still, if you're having any queries, don't worry, feel free to comment below. Our expert surgeons and our team will get back to you. If any of your family members or friends are having any queries related to rhinoplasty, or if they have any issues with their nose, please do share this video and ask them to visit Praaya Aesthetic International in Shimoga. Thank you.